Hey y'all, Professor Hurley here with another episode of Purple Bear Biology. If you haven't joined me before, we cover topics like anatomy, microbiology, and general principles of biology. If all of that sound is awesome to you as it does to me, then be sure to hit the subscribe button so that you can see additional videos I've released and more to come. This video is going to pick up where our last video left off. Previously, we talked about the major divisions of our skeletal system and explored the axial skeleton. If you missed that video, look for a link in the description section below. In this video, what we're going to discuss is the remaining part of our skeleton, the appendicular skeleton. The appendicular skeleton can be divided into your clavicle, scapula, coxal, and upper and lower extremities. Before we get started exploring them, one thing to note is that the medial and lateral become very important to this conversation. Not only do some of the names of the specific features involve these directional terms, they also help us determine left and right limbs from one another. One important note before we jump into all of this is that I will be covering the bones with their features, but I would highly advise, if this is your first time learning these, then you should start by learning the bone names and the locations, and then once you've mastered those, move on to learning the specific features. Okay, so let's jump right into the Complete Anatomy app, and like last time, let's start superior and work inferior. If you want to take a closer look at this awesome app that I'm using, then look in the description section for a link to their website below. The first bone we're going to discuss is the clavicle, sometimes called the collarbone. The clavicle has a sternal end that is short and stubby. This connects to your sternum. On the opposite end, the clavicle has the acromial end. You can see that it's broader, and this is what would attach to your scapula. The clavicle provides structural support for the shoulder and muscle attachment to hold our upper extremities away from our body. Now let's spin around to the posterior side and take a look at the scapula. The scapula occurs where your shoulder blades are and has some pretty cool features, so let's take a closer look. There are two processes that we find at the top of the bone, the acromion process and the coracoid process. Notice on the posterior side, the scapula has a ridge that runs along here. This is called the spine of the scapula. The area above the spine of the scapula is referred to as the supraspinous fossa, while the area below the spine is referred to as the infraspinous fossa. I remember these because they have directional terms in their name. Supra meaning superior, spinous to the spine. So supraspinous fossa is superior to the spine on the scapula. On the opposite side, closest to our ribs, we have the subscapular fossa. The last feature is the glenoid cavity, where the head of the humerus articulates. To determine if you have a right or a left scapula, you'll need to face the spine posteriorly, and you should face the glenoid cavity out laterally. The side that the glenoid cavity points is the side of the body that it belongs to. So this would be a left scapula. Moving on to the humerus, this bone is what makes up your arm. The part that articulates with the glenoid cavity is called the head. The shaft of the humerus is called the body, and the part that connects the two is called the anatomical neck. The surgical neck of the humerus is slightly below the anatomical neck. On the superior end, we can find locations of muscle attachment. Anteriorly, we have the lesser tubercle, while more posterior and lateral, we have the greater tubercle. Down on the inferior end, we have the condyles that articulate with bones of the forearm. To determine which condyle is which, you must determine the medial and lateral sides of the bone. The head is on the medial side, so if we follow that down, we find the medial condyle. This has a special name called the trochlea. On the opposite side, we would find the lateral condyle. This has a special name called the capitulum. If we zoom in and look superior to these two condyles, on the anterior side, we can see a notch called the coronoid fossa, which accommodates the ulna of the forearm as the arm is flexed. If we move medial from this fossa, we can find the medial epicondyle. And if we move lateral, we can find the lateral epicondyle. For the last feature of this bone, we need to rotate, and we can see a large fossa called the olecranon fossa that accommodates the forearm bones during extension. If we continue down to the forearm, we can find two bones, the ulna and the radius. Let's start with the ulna. Notice that the ulna has a large protrusion that articulates with the humerus. This is referred to as the olecranon of the ulna. Inside the U-shaped curve of the ulna, we can find the trochlear notch of the ulna. Moving inferior a little, we can find the radial notch of the ulna. This is where the radius articulates with the ulna. On the inferior side, we can find the styloid process of the ulna. You can feel this if you push on the medial side of your forearm proximal to the wrist. Now let's move lateral and take a look at our radius. Here we have the head of the radius. Moving inferior, we can see the small protrusion called the radial tuberosity. At the inferior end, we can see the styloid process of the radius. You can feel this if you push on the lateral side of your wrist proximal to the thumb. Did you know that when you feel for features like this, it's called palpating? Palpating different regions of the body is a great way to use your own body as a study guide for bones. Okay, now let's move on to the bones of the hand. You have three basic types of bones of the hand: carpals, metacarpals, and then phalanges of the hand. Individually, each of these is called a phalanx. To make things easier to reference when you talk about metacarpals and phalanges, they are numbered using Roman numerals 1 through 5. The thumb starts at 1, and we count to the pinky. Let's take a look at the individual carpals now. If we zoom in, you can see that the carpals are multiple bones that make up the wrist. Starting at this large S-shaped one, let's work our way through them. We have scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, and trapezium. Now there's a lot there, so let's talk about how to remember this. I use direction and mnemonics to help. Starting in this direction here, I work my way to the pinky and come back around to the thumb. And I use this mnemonic. So long to pinky, here comes the thumb. Now with that mnemonic, I can get the first letter of each of these carpals. So we start off, so long to pinky, here comes the thumb. Now you may notice that there are 3 T carpals, so we have to have a way to try to distinguish between them. I have nothing for triquetrum, unfortunately, but for the other 2, I remember them in this way. Trapezoid is trapped in between all of these bones. And then trapezium, like a trapeze artist on a wire, is on the border and could potentially fall off the hand. If we leave our carpals and move further inferior, we come to our metacarpals. As mentioned before, the metacarpals are numbered using Roman numerals, and this is how we reference them. So if I wanted to talk about this metacarpal, I would call it metacarpal 1. If I wanted to talk about this metacarpal, I would call it metacarpal 4. Lastly, let's look at our phalanges. Like the metacarpals, they're numbered 1 through 5, starting at the thumb and working your way to the pinky. And they add directional terms for the additional bones. Bones closest to the metacarpals are referred to as proximal. Bones farthest away from the metacarpals are referred to as distal. Your thumb only has 2 phalanges. However, the other 4 digits have proximal, middle, and distal. Let's say I wanted to name this bone. This would be proximal phalanx 1. If I wanted to name this bone, it would be middle phalanx 4. And then lastly, if I wanted to name this bone, it would be distal phalanx 3. Kind of neat, right? Okay, so let's move from our upper limb over to our hip. This bone is referred to as the coxal bone. The coxal bone at birth is actually 3 bones fused together: the ilium, the ischium, and the pubis. Let's take a look at the features of each, starting with the ilium. The ilium has a ridge that runs along the top part of it. This is referred to as the iliatic crest. The iliatic crest is where you might put your hands if you were feeling sassy. This area right here that is indented is referred to as the iliatic fossa. Now the next four features tend to sound like a lot, but really all we need to do is orient ourselves to the anterior and posterior side of the bone. The anterior side of the ilium is the side that connects to the pubis. The posterior side is the side that connects to the ischium. Once we have this directional information down, we can name our four next features. Notice that as we come to the end of the iliatic crest, it comes to a rounded point. This rounded point is called a spine of the ilium. So, to name this one, it is on the anterior side, and it is superior to the spine directly beneath it, and then it's a spine, so we call it the iliatic spine. To name this feature, we would name it anterior because it's on the anterior side. It's inferior to this spine, and it's an iliatic spine, so we name it iliatic spine. So on this side we have the anterior superior iliatic spine and the anterior inferior iliatic spine. Now while that sounds like a lot, all it really is telling us which side of the body we're on and if we're talking about the inferior or the superior spine. If instead of going to the anterior side, we follow the iliatic crest to the back, notice that there is another spine. Now this is on the posterior side, so if we wanted to name this one, it would be posterior superior iliatic spine. And then notice that there's an inferior spine as well. So if we wanted to name this one, it would be the posterior, because we're still on the posterior side, inferior iliatic spine. So again, while it sounds like a lot, we're just talking about the side of the bone, and then whether or not it's superior or inferior, and then it's the spine of the ilium, so it's the iliac spine. Kind of cool. While we're on this side of the bone, you may note that this is the side that actually articulates with our sacrum. This is the part of the coxal bone that makes up the other portion of the sacroiliac joint. If we go a little inferior of these spines in the sacroiliac joint, we find this very large notch. This is referred to as the greater sciatic notch. As we move from the ilium to the ischium, let's rotate around to a lateral view. As mentioned before, here's our greater sciatic notch. Now you notice this protrusion here. This is the spine of the ischium. Directly beneath it, you'll notice another notch. This is the lesser sciatic notch. If I rotate a little bit more, we can see our next feature, and that's called the ischial tuberosity. Transitioning to the front of the coxal bone, we can see where the ischium connects to the pubis. The pubis has a superior ramus and an inferior ramus. Additionally, the pubis has a medial border that articulates with the other pubis of the coxal bone on the opposite side of the body. This is referred to as the pubic symphysis. The last two features we're going to learn about is this large foramen called the obturator foramen, and the socket where the head of the femur articulates is called the acetabulum.
So students tend to really struggle with the coxal bone, particularly trying to determine whether or not they have a right or a left coxal bone. Let me show you how I do this. So I put the pubis on the anterior side, and I make sure that the acetabulum is pointing out and laterally. When set up this way, I should be able to take the greater sciatic notch and place it in between my thumb and my index finger. I can then wrap it around and hold it like this. If all of that is in place, this would tell me that I have a right coxal bone. What would have happened if I had put this in my left hand instead? Well, let's try to do the same process with a right coxal bone in the wrong hand. So let's take a look. If I were to put it here, I orient my pubis on the anterior side. I've already had to put the bone upside down. That doesn't make any sense. But let's say that I made a mistake and I put the pubis on the anterior side like this, and I put it in my left hand where the greater sciatic notch slides in between the thumb and the index finger. Can it still wrap around? Yeah, sure, absolutely it can. But not only does it not feel right in my hand, the pubis is actually pushing against my hand, doesn't want to let me do it, but my acetabulum is now pointing medially. How in the world would my femur articulate with this coxal bone if this were the left side, if the acetabulum's on this side? It can't, right? The only way that this works is if the acetabulum is pointing out. Now, if I were to point the acetabulum out on this side, I can't get my thumb and index finger to the greater sciatic notch, and the pubis bone is on the wrong side. It's pointing posteriorly now. So hopefully that helps.
All right, now let's move down to the lower limb. This bone is referred to as the femur and is the largest bone in the body. Like the humerus in the arm, this bone has a head that articulates with a ball and socket joint with our coxal bone. Here we can see the neck of our femur. This large protrusion is referred to as the greater trochanter of the femur, not to be confused with the greater tubercle of the humerus. On the posterior side, we can see the lesser trochanter. Staying on the posterior side and moving down to the inferior end, we find two condyles. We have to determine which side of the bone it is to determine if it's a medial or a lateral condyle. Just like in the humerus, the head of the femur points to the medial side of the bone. So that tells me that this is the medial condyle. And if this is the medial condyle, then this must be the lateral condyle. If we move to a medial view, we can find the medial epicondyle. If we move to a lateral view, then we can find the lateral epicondyle. Before we move on to the tibia, let's mention that we have the patella in the front. This is your kneecap. Now let's move down and take a look at the two bones of our leg, the tibia and the fibula. The tibia is the weight-bearing bone in our leg. I separate these two bones by getting goofy with their names. I remember it as tough tibia and flimsy fibula. I know it's goofy, but man does it help me remember. Let's look at the features of the tibia itself. First, we have the tibial tuberosity that can be found on the anterior side of the tibia. If we take a more superior view, we can find our medial condyle and our lateral condyle. These match up to the medial and lateral condyles of the femur. At the inferior end, we can find the medial malleolus. This is actually what makes up the medial side of your ankle. Now let's take a look at the fibula. The fibula has a head that is a rounded surface, and at the inferior side has the lateral malleolus. Students oftentimes have trouble distinguishing between the head and the lateral malleolus. If you look at the lateral malleolus in close detail, notice that it's flat and long. However, if we were to look at the head, we would notice that it's much more rounded and not flattened on either side. The lateral malleolus acts as the lateral part of your ankle. Okay, now let's finish strong with the bones of the foot. Your foot, like your hand, is organized into three types of bones: tarsals, metatarsals, and then phalanges of the foot. Like the hand, the metatarsals and the phalanges are numbered using Roman numerals, 1 starting at the big toe to 5 at the pinky. Now let's take a look at the individual tarsals. If I spin around, you can see that you have 7 tarsals. We can see the talus, the calcaneus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. Now there's a lot there, just like with the carpals of the hand. So I have another mnemonic that I use to remember this. Tiger, cubs, need, milk. M-I-L-C. So the first letter in each of these represents the first letter in each of the tarsals' names. Talus, calcaneus, navicular, and then medial, intermediate, and lateral cuneiforms, and then cuboid. Like I said, the Roman numerals are used to number the metatarsals as well. So if I wanted to refer to this metatarsal, it would be metatarsal 4. The numbers continue down to the phalanges as well, except just like with the hand, we must use directional terms to identify which bones of the phalanges we're talking about. Proximal and distal are found on the big toe. Notice that there is no middle bone inside of the big toe. Here we have proximal, middle, and distal phalanx. So if I wanted to name some of these, I could pick this one right here, and that would be middle phalanx 3.
If I chose this one, it would be proximal phalanx 1. Kind of cool, right? Just like with the hands. Pretty neat. It's an interesting way to identify the different bones so that we can be incredibly specific which bone of the foot we're talking about.
Okay, you made it. Congratulations. You have explored the appendicular skeleton. If your mind is blown, then remember that you're just beginning to learn these bones. Dedicating them to memory will require extensive practice over an extended period of time to get efficient at quickly identifying them and their features. Use flashcards or labeled drawings. Palpate regions on your own body to see if you can feel features, and make sure to take breaks while you're learning. If you feel you have mastered a bone and its features, then move on to another and come back in a few minutes to test your retention. If you have somebody to study anatomy with, then you are super lucky. Quiz each other by pointing to different bones and come up with funny ways to remember them. Anything you can do to make additional neural connections to the content will help you recall it later. Well guys, that's it for this episode of Purple Bear Biology. If you haven't done so already, make sure that you subscribe so that you can see additional videos that I release. And if you found this video helpful, make sure you click the like button and recommend it to a friend. Alright y'all, thank you for visiting with me, and I'll catch y'all next time.